The study of autism has a complex history. Over time, the categorization of autism has varied significantly and today is referred to as autism spectrum disorder. With so many changes to the medical literature over such a short period of time compared to other disorders, this can raise some questions, one of which being, what is the spectrum? To understand what is meant by this terminology, it may be beneficial to get a general overview of the history of autism. One of the earliest conceptualizations of autism in medical literature was in 1798 when French physician Jean-Marc Gaspard described a young boy as being withdrawn and showing signs of language and intellectual disability. Over 100 years later, in 1910, Swiss psychiatrist Paul Bleuler coined the word autism when referring to specific symptoms of schizophrenic patients. In the early 20th century, views on the causes of autism were mainly informed by Freudian psychoanalytic theory, which at the time was popular. Due to this, autism was thought to have causes rooted in emotional or psychological factors, not biological or physical factors. In the 1940s, child psychiatrist Leo Kanner focused on parenting, specifically maternal parenting styles, as the cause of autism. Thankfully, in the 1960s, researchers began to shift their focus towards biological and neurological factors as playing a role in the cause of autism. Early research pursuing this avenue started with Stella Chess, an American child psychiatrist, and her research into autism as a neurological disorder. During this time frame, 1965 to be exact, Ole Ivar Lovas, a clinical psychologist, developed applied behavioral analysis as a therapy. While his early methodology was problematic, particularly by today's standards, he did see some successes in treating targeted behaviors. Over the decades, as research into autism developed, the definitions and diagnostic criteria of autism began to change. Autism was officially separated from schizophrenia in 1980 and was labeled infantile autism. In 1987, the definition was expanded and retitled to autism spectrum disorder. The clinical definition changed once again in 1994 when pervasive developmental disorder, not otherwise specified, and Asperger's syndrome were included under the umbrella of autism spectrum disorder. At the present time, autism spectrum disorder now encompasses Asperger's syndrome, pervasive developmental disorder, not otherwise specified, autistic disorder, and childhood disintegrative disorder. Each of these subgroups vary in the intensity of symptoms and deficits that may or may not present themselves. This variety of symptoms and deficits is what's referred to when speaking about the spectrum. The signs of autism spectrum disorder present themselves differently in each affected person. Research into autism spectrum disorder continues to this day and will continue to shape treatments such as ABA therapy. At MTC, our BCBAs keep up to date on the most recent developments in modern research. As the sciences continue to improve, so will our ability to improve the quality of life for those affected by autism spectrum disorder. For more information on services that we offer here at Mobile Therapy Centers, please visit our website. Links to our website and sources used for this video will be included in the description.